Namaskar and good evening. Friends, the stock markets have stopped falling to a certain extent. They are going up and down, but now a little stable. So it seems that we have reached the bottom. You can't say definitely, but it is under the influence of coronavirus itself. Now, about coronavirus, many TV channels are spreading many guidelines from experts. Our central government, under the leadership of Narendra Modi, has also appealed for social isolation. Do not mingle with all people. Keep a distance between you and the rest of the world. How much distance? About 1 meter. Now, you may have heard many such guidelines, but I would like to give you the guidelines from the website of World Health Organization. What they say, we need to know the latest as of today. Now, WHO site says you can reduce your chances of being infected or you spreading COVID-19 coronavirus by taking some simple precautions. You should not get infected and you should not infect others, both. So, the first one that they say is regularly wash your hands. So, we have seen wash the front side, wash the back side, wash the spaces between the fingers, and like this also. So, like that, wash your hands with soap and water, and if possible, any alcohol based hand rub. Why? Washing your hands like this will kill the virus which is on your hands. If it has already gone inside, that's a different thing. But after going out and coming in, you should try to wash like this periodically. Next, maintain at least 1 meter distance. 1 meter means one hand, say 3 feet. So if you stretch your hand, the other person should be on that side. 3 feet distance between yourself and anyone who is coughing and sneezing. If you find anybody coughing or sneezing, just go behind. Put at least 1 meter distance, because the droplets which are coming out from his mouth and nose, so they should not infect you. They have the possibility of traveling up to 1 meter. So, once they reach you, then only the problem starts for you. So, if you are away 1 meter, there is no problem. So, don't be too close. And then, see, when you go out especially, you are likely to come in contact with people less than 1 meter also. You may not actually touch them. Yes, you must not touch them. You should not allow them to touch you. That is social isolation. And WHO says put 1 meter distance. And see, at any point of time, sometimes it so happens it comes less than 1 meter, maybe 1 foot also, and somebody sneezes, the droplets from his nose or mouth travel right up to you. It may fall on your hands or even mouth. Unseen droplets. Now, it may, suppose it falls on your hands, etc. Probably face, they may or may not fall. If it falls on your hands, etc., avoid touching your eyes, your nose, or your mouth with your hands. Why? The coronavirus, please remember, this is very important thing. See, ultimately, its destination is your lungs. It goes and spreads in your lungs. It multiplies there. Now, from there, how can it come outside and infect others? It is only through your mouth and through your nose. If the other fellow is coughing and sneezing, it is coming from his stomach, that is from his lungs. Now, if you are coughing, then also it is coming from here. It will travel to the others. So, your mouth and nose are the inlets and outlets for these coronavirus droplets, which are stored in the lungs. Make sure you and the people around you follow good respiratory hygiene. This means covering your mouth and nose, and especially how to sneeze. Suppose you get a sneeze, you may not be ill, but you may get a sneeze or a cough like this. Keep your hand like this at the elbow, like that. So, and if you have a kerchief or something like that, tissue paper, with the tissue paper you cover and then throw off the tissue paper. Then there are many guidelines which are given by the respiratory hygiene, what WHO has not stated, that you can practice. You know what Baba Ramdev says, Anulom Vilom Pranayam, Kapalbhati Pranayam, that you can practice. That is not stated by WHO, that is told by Baba Ramdev. I am a practitioner myself. So, that hygiene you will need to maintain. Then, stay home if you are unwell. If you feel slightly feverish, or if you are having cough, cold, sneezing, etc., stay at home. Do not infect others. Don't go out. That is a time when you also can get infected. So, seek medical advice. Suppose you are not well, seek medical advice. Follow the directions of your doctors. Your doctors will guide you then. They will check up, and if necessary, they will guide you to the proper doctor. Then, in your place, in your town or city or district, what are the COVID-19 hotspots? Try to know. You are seeing the TV. Almost everybody is seeing TV nowadays. So, avoid traveling to those hotspots. In India, our Prime Minister has said don't travel anywhere. That is the best thing. But in any case, avoid traveling to those COVID-19, that is the coronavirus hotspots. So there, the chances of catching coronavirus is more. Then, self-isolate. That's what our Prime Minister has said. Self-isolate by staying at home. If you begin to feel unwell, even with mild symptoms such as headache, low-grade fever, 37.3 degrees centigrade, and slightly running nose until you recover. You see, it may have nothing to do with coronavirus. It may be an ordinary cold and cough also, but don't go out. Now, Prime Minister Modi has said, don't go out at all. Whether you are well or unwell, don't go out. 21 days is the period. You may catch, you may give. Both should not happen. So, the circuit should be broken. That's what the Prime Minister says. Now, that is what other countries are also trying to do. Now, suppose you are unwell and you are the only person at home, something like that. You ask somebody to go and fetch your food, etc. Not food, rice, etc., rice, dal, whatever you need. You don't go out. As far as possible, if you are unwell, don't go out. Avoid contact with others. And you avoid going to doctor also unnecessarily. So that is also not needed. So, and if you have real difficulty in being unwell, that is, your cough is more, your sneezing is more, Cough, especially if it comes from here, there is no problem. Please understand. If it comes from here, then you have to be very careful. So they immediately contact doctors. Now, should you wear a mask to protect yourself? WHO says only if you are ill with the coronavirus or having symptoms like that, or you are looking after someone who is having those symptoms. Either you are having the symptoms, it may not be coronavirus. You may have symptoms only, or you may be looking after somebody who has symptoms. Then wear a mask. Disposable mask means it can be used only once. Now there is a shortage of masks, therefore don't wear masks always. Now I find people on the road wearing masks. Everybody is wearing masks. So don't waste masks. They are very hard to come by. Now generally clean your hands, cover your cough with the bend of your elbow, maintain a distance of 1 meter. So these are all I have told already. Now suppose the coronavirus goes inside you. When it will show its symptoms, it can be anywhere between 1 day to 14 days, usually 5 days. It will show the symptoms. Can it come from animal sources? It is not yet certain. In one place, a dog was infected with this virus, but still it is not certain. But anyway, WHO says when you are visiting a live animal market, avoid direct contact with the animals and surfaces in contact with those animals. Just a precautionary measure. WHO said don't touch those animals. Ensure good food practices. Handle raw meat, milk, animal organs, etc. with great care to avoid contamination of uncooked foods and avoid consuming raw and undercooked animal products. So whether you will get from your pets, it is not yet certain, but be careful. WHO is monitoring, but it is not yet certain. So I am not going to take much time. So how to put the mask on? So don't touch this surface, touch here only, like this, and you should cover your mouth and chin both, like that. So many things are there. Now basically stay at home. If you are staying at home, these 21 days are very, very essential for social isolation. If these 21 days are spent at home, many people are coming out. See, the problem is with them only. If India goes from stage 2, now we are in stage 2, so the communication is not coming with the society. If we go to that level, it's very difficult. Now, if it goes to that level, because of whom it will go? Only because of those people. Now also people are going and gathering in various places. That's not correct. Don't go to any such places. No gatherings outside your home. Now, you can go to get your medicines, your vegetables, etc. Those things are there. Take a identity card or something like that. Now, I have a request to the police also. Please don't beat unnecessarily. I have seen a number of videos where policemen are very responsible, very correct in dealing with the people. But at the same time, some policemen really treat cruelly, inhuman, unnecessarily. See, the lathi is to be used very sparingly. Only if people are not willing to obey you, then you use it. Otherwise, ask them to go, they will go. At least 60% of people will go. 20% of people will go with 1 or 2 warnings. But only 1% or 5% of people may argue. For them, you use whatever methods you normally have to use. Police are our protectors. Doctors are our greatest protectors. So we have to take care of them at this point of time. So take care of you, take care of your people at your home. Tell them also all these things. This is straight from WHO. I am not telling you anything myself. Therefore, keep all these precautions. They will let us see that in these 21 days, India should come out of this coronavirus. Some vaccines are getting ready. They may come in the meantime. If they come and if they are effective, the whole human race will come out of this coronavirus. Let us hope so. Let us anticipate a very bright future. Our stock market also will recover the moment we recover from coronavirus. Thank you for listening. We'll meet again on stock markets. Thank you.